Hello, I'm with Dr. Ram Manohar, who is the Director of Research in Ayurveda at Amrita University, one of the largest private universities who conduct research into nanomolecular medicine and have taken a great interest in this integrative system of Ayurveda. My question to Dr. Ram Manohar is, you as a researcher, you seem to think that we are ignoring the placebo effect, almost to the extent that you could even, if you want to sensationalize it, say placebo is the future medicine. Why do you say that?
Yeah, I mean, I think the placebo effect is misrepresented, and it's actually a misnomer because the placebo effect has been used basically to eliminate what is called as a chance effect, in clinical trials, and to establish the real effect of pharmaceutical, drugs. But the fact is that all this research using placebos over many decades have shown that the placebo effect might not be by chance alone.
Right. Okay.
Yeah, it's because it's placebos have been there in almost all the clinical trials,
Hmm.
and for a significant number of times it's been proven to be effective, sometimes even more effective than the trial drug.
Right. Is there an example of where placebo has been more effective than the trial intervention?
Yeah, if you want to really sensationalize it, I would like to give the example of angina.
All right. Yes.
And in
Which is very
angina,
common. Yeah.
yes, and in angina there was a surgical procedure of ligating the mammary artery.
Hmm.
And when they did this surgery, normally surgical interventions are not controlled by placebo.
Yes.
So, when this intervention was first evaluated, there was a 73% effect for this mammary artery ligation.
Yeah. The actual surgery had a 73%
Percent
effect.
effect. And later, there was this curiosity as to whether a placebo would also work equally well. And they designed a sham surgery. Sham surgery means, placebo is also known as sham.
Sham. Yes. Yeah.
And so they just opened up the chest of people suffering from angina under the pretext that they would ligate the mammary artery, but they did nothing. And this procedure gave 83% effect
Hmm. So which is far more
than
the actual
the
surgery.
actual surgery. So these kind of examples abound. And what I think is that we are missing in the modern understanding of the placebo effect is the power of the mind over the body.
Yes. Dr. Ram, you talked to me about this in my interview with Dr. Ram on Unlock Your Health, and you say that actually we have focused too much on how the molecules in the body can influence the mind, but we want to completely ignore or even demolish the effect of mind on the molecules in the
Yes.
body. Can you talk to that a little bit?
Yes, I mean, even in modern medicine, this is being increasingly understood through what's called the psychoneuroimmunological axis.
Uh-huh.
That the mind talks to the brain, and the brain talks to the immune system,
Mhm.
and also to the endocrine system. So this is also not totally alien to modern scientific thinking, but it's just that it's still not become the mainstay,
Yeah.
of medical practice. So in modern times, we are thinking of, even though we are looking more into these kind of non-medical interventions, they are looked at to supplement pharmaceutical treatment.
Yes.
Whereas in Ayurveda,
Mhm.
it was the other way around.
Yeah.
That you had to primarily rely on activating the healing process, through the mind, and take it to the extent that is possible. And then when you supplement it with other treatments, including pharmaceutical medicines,
Yes.
then the extent to which you are using these kind of strong, interventions could be optimized. This would lead to less costs,
Yeah.
less side effects,
Mhm.
and eventually better immunity and higher states of health.
Yes.
So I think there's a real need to shift from medicine, pharmaceutical oriented medicine,
Hmm.
to more mind based medicine.
Right. Yeah, and I remember that in my interview with Dr. Ram Manohar, Ram said that we have developed a medical education system which completely kills compassion,
Yes.
and it's so important to actually practice medicine with compassion.
Yes.
My final question to you, Dr. Ram, is: do you think that empathy, as a researcher, does empathy really have a benefit in a patient getting healed?
I definitely think so. Because this was very well recognized in Ayurveda.
Hmm.
And I think this is what was called as also the blessing of the hand
Right.
of the physician. In Kerala,
Yeah.
this is in the Ayurvedic tradition. This is very well known that there is a magical touch.
Yeah.
When there is this communication, a deeper communication, because this is also fundamental in Ayurveda, that the texts very clearly say that if you want to heal the patient, you must touch the inner being of
Yeah.
the individual. And empathy is that which breaks these barriers,
Right.
our zones, our personal zones, which
Mhm.
separate us from each other. And there is that deeper flow of energy which can activate this process of healing. And I think that's why, professional training does not always make you a successful physician.
Right. Yeah. Yeah.
And this was very well recognized in the Ayurvedic tradition.
Uh-huh.
So I think even medical education needs to be changed. Even the way you organize the syllabus,
Mhm.
starting with dead body dissection, can make you really insensitive to
Yes.
human, pain and suffering. And in Ayurveda, it was really emphasized that you must begin the study of the body with birth, so that
Yes.
you respect life,
Yeah.
and then you see death as something that should be dealt with in a very different
Yeah.
manner.
Yes.
So I think the education system has to change,
Mhm.
and we need to bring these values. And this is being recognized in many places. In Israel, recently I had the opportunity to discuss with some of the professors there who are working on what is called as creating the caring culture,
Uh-huh.
and in which empathy is at the center.
Yes.
And they are talking really about, very disturbing statistics of
Mm.
about the way medicine is taught and practiced is leading to even personality disorders
Yes.
amongst physicians.
That's
So,
right. Yeah.
so empathy is not just important for the patient; it's also important for the physician to, be more balanced and invoke higher energies in the process of healing.
Fantastic. I'm really very pleased that I've had the opportunity to interview Dr. Ram Manohar, who comes from this institution, who is leading the research, what most of us know as the hugging saint, who is spiritually very evolved, who is now also leading the scientific and technological development in India. And we have masterminds like Dr. Ram Manohar, who are bringing Ayurveda into the realm of healing and medicine. So to listen to the entire interview, do stay tuned to Unlock Your Health, and the website is www.uyhradio.com. Thanks, Dr. Ram.
Thank you. It was a pleasure.